Veronica, on the breakfast show now, we'll switch our attention to primary health care and efforts that are in place to transform this sector. And I have with me people who are competent to discuss this topic and who, of course, are the helms of affairs to ensure that the primary healthcare system works in the country. First, I'll introduce the senators here with me. Senator Ibrahim Oloriegbe, Chairman, Senate Committee on Health. Thank you very much for your time, sir.
Yeah,
thank you. Welcome to prayer. Senator Chukwuka Utazi, no particular order, representing Enugu North, and you are representing Kwara Central. Senator Chukwuka Utazi, representing Enugu North Senatorial District, Chairman, Senate Committee on Primary Healthcare and Communicable Disease. Well, you're welcome to the program, sir. And also Senator Sadiq Umar, he's the Vice Chairman, Primary Healthcare and Communicable Diseases, representing Kwara North. And Dr. Faisal Shuaib, the Executive Director and CEO of the National Primary Healthcare Development Agency. You're welcome to the program, sir.
Yeah, good morning, viewers.
Yeah, let's set the ball rolling now. Efforts are in place, we understand, both at all levels of government to ensure that the primary healthcare system is fixed in the country. Now, bring us up to speed with these recent efforts.
President Muhammadu Buhari has been very, very clear around his vision for healthcare in Nigeria. Underpinning this vision is a country where nobody will have to go without basic healthcare. So primary healthcare is the foundation of any health system. And one thing that Mr. President has consistently talked about in the last 5 years has been his vision to make sure that we have quality basic healthcare everywhere in Nigeria, irrespective of where you live or where you work. In the same vein, the Honorable Minister of Health, Dr. Osage Ihanure, has been very, very clear about his policy direction, strengthening primary healthcare. Because primary healthcare is the foundation of any health system. Once you strengthen it, then that house stands on a very solid foundation.
In changing the narrative, we also know that funding is very important. You talked about investing in the health sector. And now let's come to legislative backing now for this this huge project of revitalizing the primary health sector. From your own standpoint as the Chairman, Senate Committee on Health, what is the legislature doing to ensure that all these noble dreams and aspirations are indeed achieved?
Just taking up from where the NPCDA has spoken. NES systems has pillars. We have, from analysis from WHO, there are 6 pillars to strengthen any health system. One of the most important is financing. But of course, we have to look at human resources, we have to look at commodities and supplies. I'm mentioning these 3 because the other 3, in one way or the other, we have them. And I'll come to link it to your questions. I mean, the other 3 will include when we talk about governance, and then we'll talk about policy. So, but for primary healthcare in Nigeria, the president, and even I would say in the past, previous administration has been talking or doing some steps, but it has been like tokenism. The National Assembly before us passed the National Health Bill,
yeah, that's true.
Putting 1% for basic health care, which this president in 2018 started to implement. And this administration has put it to become a statutory transfer. But if we look, how much are we talking per annum that goes to primary health care is very small. So as legislators, that's why I'm coming. Financing primary health care cannot be successful with such annual routine of putting small money. What we need to do is to do like a Marshall Plan, which the executive, through the NPCD, has presented to us. A plan that look at where do we want to be in 10 years and what does it cost us to reach this thing. If we don't do this investment, we are not going to reach that. And as legislators, we have analyzed and we have accepted that plan. And we are now, the legislative is to be able to allocate the resources. We want to see from this 2021 that we increase the allocation.
Okay, Senator Utazi, how would you also ensure that when this thing come on board, it's properly monitored in terms of oversight and all of that, to make sure that it does not lose track? Because people are saying we've seen brilliant projects come up in the country, funds devoted to it, but at the end of the day, everything goes down the drain. How do we ensure this primary health care that is critical in enhancing or improving Nigeria's life expectancy rate is indeed something that is worth the while?
The issue, what the president of a country as a leader should do is to show the direction. It is now left for the other parts of the government to take a full ownership. And that's what we are doing here. We now don't want to wait until everything gets too bad before we start. That's why the Primary Healthcare Development Agency is spearheading this thing with the Ministry of Health that we will start taking for 10 years. We are looking for $1 trillion. We don't have the whole trillion. But let us start now. And we are starting it now that we are doing the budget. We don't want this thing to escape this 2021 budget. We are beginning from 2021 that will last to 2030. And once we start doing that, we'll be responsive to the health of this country. That's why we're heading to.
Senator Sadiq, a lot of people have said that there is no magic wand that can be used to just fix all of these in the twinkle of an eye. An all-hands-on-deck approach, but it's that atmosphere. How well has that atmosphere been created to ensure that, yes, indeed, stakeholders understand what needs to be done and are also willing, both the political will and whatever it takes to ensure that these projects succeeds?
Now, the situation today is that out of all these primary care centers, less than 40% of them actually have an infrastructure that you can call infrastructure for primary health care. About 20% are the ones that have staff that are available to treat people. How do we turn this around? It has to be an aggressive move, and that aggressive move has to be special intervention. Federal government has to show that it's serious. It really wants to achieve, universal health coverage by 2030. Yeah, the Basic Healthcare Appropriation Fund is a good one, but it's a patronage song. It will not do it. We need to respond, in fact, better than the response we have with COVID. COVID response was good, but hey, like I keep on saying, we lost about 1,000 persons in COVID. Do you know how many people died daily? Children, women, because there are no functional primary health care centers in the wards. And we have a good policy that has been passed several years. We want a functional primary health care per ward in Nigeria. It's there. We've not been able to achieve it. We need to do something about that quickly, and that is why we think that federal government needs to show that willpower by bringing out the big money, about 500 billion. If federal government does that, I can tell you that the private sector will come in, development partners will come in because we are serious. We've shown the will to do this.
Yes, Edie, the polio eradication was a success despite hiccups here and there that tried to slow down that effort. And looking at the primary health care, it's that system that helped to drive the eradication of polio. What are some of those, would I say, lessons in the successes of eradicating polio that still can be applied to preventing other communicable diseases at the primary health care level? And by the time all of this come to place, again, the development partners that you want to bring on board, how willing are they to invest in a system? Do they have that confidence to say, indeed, if we invest in developing or improving primary health care in Nigeria, the purpose of that investment, the purpose why that investment was intended, would be achieved?
Yeah, absolutely. What our eradication of the wild polio virus demonstrated to all Nigerians and people globally is the fact that once Nigerians are committed to doing anything, they get it done, right? And the same resources that we've used, the same skills, the same capabilities around mobilizing communities, around interpersonal communication, around using frontline technology such as geographic information systems. These are the same resources that are being used to address the COVID-19 outbreak, and see how well we're doing it through the Presidential Task Force and the Federal Ministry of Health, that are involved with other critical ministries and very important stakeholders. So what we are doing now is getting alignment from our development partners. They understand that there is a need to strengthen primary health care. They understand that we cannot continue as a nation to be focusing on a verticalized health system, where today we want to focus on polio eradication, tomorrow is measles, the day after is nutrition, and then, maybe the day after that,
family planning.
Yes, family planning, development partners, coming in with their different projects. What we're saying now is let's harmonize all of these different programs. Once you have a solid base, a solid and functional primary healthcare system with health workers who are well trained, they'll be able to manage each of these diseases in a very integrated and comprehensive manner. The whole world is going towards more synergy in the way we do things, moving away from a silo approach, right? Having one plan that everybody, aligns behind. But what is very, very critical about what we're saying here is not just the funds as well. We're also going to put in place accountability and transparent mechanisms to make sure that once these funds are made available, they actually get the job done, right? So we're looking at 2 years down the line to say, here we are. We had a vision that was espoused by Mr. President. We had policy directions from the Honorable Ministers of Health, and the legislature and the executive work together to actualize this vision. We want to see a situation where in the next 2 years, you can go to every single ward in Nigeria and you have a functional, truly functional primary healthcare system where people are working, where you can walk into and people will treat you very well. The staff are well motivated, they are committed to getting the job done. We've heard from our development partners, we've heard from our donors. This is exactly what they would like to see.
Listen, what does this mean, for instance, for people in your constituency when they hear about this plan by the federal government to revitalize the health sector? What does it mean for them?
It actually means everything to the people in my constituency because, like I've always argued, the strength of a nation, our path to development is by facing health and education. And health comes first. You have to be healthy to actually be educated. So when you have healthy citizens that are educated, you get productive citizens. Then you open opportunities for them, and the country will grow and develop. So my people cannot wait to see that they can walk up to a functional healthcare system where they can have a primary care services under one roof. We have that policy in this country where there's integrated services in one place. Good quality healthcare services that is affordable and accessible. My people will be more than happy to see that in this country.
Senator Utazi, will it reduce medical tourism drastically?
Definitely. You see, the problem why things are going haywire the way things are is because we have not planned well. And like I said, COVID exposed all this. Today, everybody is assessing healthcare in the country. So we want to stand, we don't want this thing to be a one-off thing, that once COVID pandemic is over, we return to our old ways of doing things. No, we want to make it permanent, that we can get everything done here. And the money we are looking for is not money that is going to be kept in Abuja here. It is money that is going to go down, this 500 billion we're looking for. We'll get to every local government area. We'll get to every ward.
Dr. Fraser, well, as it stands now, looking at the status of the primary healthcare system as we have it currently, some people have said that the system is currently overwhelmed with the COVID-19 pandemic, and I'm even a little bit worried that this might affect the way you handle or respond to other diseases or prevention of other diseases at the primary healthcare level. How are you balancing all of this?
You're absolutely right. What COVID-19 has done is shift a lot of focus, to containing the outbreak. What the lockdown has also done is it has reduced movement. It prevented community members from going to the health facilities. So we've seen immunization rates have dropped, antenatal attendance has dropped. We've seen hospital deliveries have dropped. So what we have also seen is that because of COVID-19, there are secondary diseases like measles, that are now increasing, right? So we do need a strong and reliable, functional primary healthcare system to make sure that even with shocks such as outbreaks, these continuous outbreaks that we have, whether it's Lassa fever, whether it's meningitis, whether it's COVID, that we have a full complement of health workers at the primary healthcare level who will be able to manage this, and the stressors will be minimal.
Sorry, can I just comment
Go ahead,
on
please.
this question about the importance of primary health care and even the pandemic or any future pandemic, and how the earlier question of primary care, as I said, is both preventive and rehabilitative.
Yeah.
Because when somebody goes to tertiary health care, if you've been discharged after treatment, the best place for rehabilitation is primary care. But I want to go to the preventive aspect. If we strengthen primary health care and we spend these resources, even for this COVID, the immediate next step for COVID is vaccination. There's no level that will respond to that except primary health care. We have a 200 million population. If, for example, everybody, like every country is saying, want to vaccinate, the people will not go to teaching hospitals or general hospitals. They have to go to primary health care. So therefore, if Nigeria wants to overcome quickly COVID-19, then we need to strengthen primary health care, because that's where immunization is given. Not only for COVID-19. Definitely, as we relate with the environment, we should expect any other such outbreak of, because this disease, to some extent, people are relating it to interaction between man and animal, because what we call zoonosis. So if we have any type like that, it's a strengthened primary health care that will respond to it, that will help us. Then too, prevention or response to COVID-19 and similar things mostly require communication. Like, for example, we are lucky, as he said, with what we have, but it's not every community has television or radio that will watch PTF giving directives or so. Yeah. But every community has a primary health care and has what we call World Development Association. We have, among which are gatekeepers or people that speak to people. So strengthening primary health care will not only enable us to, like what you said, about other diseases, but when we have outbreaks, it is that particular primary care strengthening that will be able to communicate well. So there is a lot of linkages. As we said from the beginning, if you don't have a good foundation for a house and you have a good roof, the roof cannot stand. So a good foundation for the health system is this expenditure.
Just like we have been spending, this is not the first time we've done that. Primary health care, the basic primary care fund has always been there, but it's small. We don't get that much. But if we put these resources, which we have been distributing along the line, we will add all these resources together and have a very, very big positive impact in the lives of our people. Once we do that, things will work well for this country. So we want Nigeria to believe in us. We want the private sector also to come in on this issue. The development partners want them to join us holistically, not piecemeal, take one thing at a time. We want everything together. Once we put this in this place in proper perspective, I'll tell you, Nigeria will be heading to Eldorado in terms of our health provisions.
That's a fine place to leave it. Nigerians are indeed hopeful and waiting for that time when the health system will work for them.